This chart shows the changing rates of colorectal cancer. While incidence drops steadily for older adults, the trend for those under 50 moves in the opposite direction. If this trajectory continues, by 2030, nearly a quarter of rectal cancers will be diagnosed in this younger age group. Researchers investigating this trend have focused on a specific nutritional factor that has shifted alongside these rising rates: total vitamin D intake. These early onset cases are often more aggressive and diagnosed at later stages than older patients. Most notably, they frequently appear in people with no family history of the disease. If genetics aren't the primary driver, we must look at how a modern generational shift in environment or daily habits leaves younger colons vulnerable. While lifestyle factors like sedentary behavior play a role, researchers have isolated a significant shift in the American diet that began in the 1980s. Milk is the primary source of vitamin D in the United States, yet consumption has plummeted across recent generations. At the same time, we've seen a decline in secondary food sources of the vitamin, including fish, mushrooms, and eggs. Abandoning these traditional staples may have inadvertently created a widespread generational deficiency, just as early-onset cancer rates began to climb. The strongest evidence for this connection comes from the Nurses' Health Study 2. Researchers tracked over 94,000 women for 30 years, creating a massive dataset on long-term dietary habits. This bar chart shows how vitamin D intake relates to cancer risk. Maintaining 300 to 450 international units daily reduced early-onset colorectal cancer risk by roughly half compared to the lowest intake. The data shows vitamin D works by suppressing adenomas and serrated polyps, precursors that can eventually mutate into cancer. By neutralizing these growths early, vitamin D acts as a biological intervention decades before most patients are even old enough for their first screening. This comparison chart shows a significant distinction in how we get the vitamin. Obtaining vitamin D from food sources was associated with a much stronger protective effect than taking it as a supplement. Dairy products were the primary driver of this dietary advantage and the resulting risk reduction. Supplements may underperform because multivitamins often contain high levels of other nutrients, such as retinol, which can actually offset vitamin D's benefits. Additionally, dietary intake typically reflects a sustained nutritional habit built from adolescence, rather than short-term pill usage later in life. The findings suggest that complex whole food sources provide a biological advantage for colon protection that isolated supplements struggle to replicate. At the cellular level, vitamin D inhibits the migration and invasiveness of colon carcinoma cells, essentially slowing down their ability to spread. This isn't just a local trend. Data from 17 international cohorts shows that vitamin D deficiency is linked to a 31% higher overall risk of colorectal cancer. However, there is a catch. The blood concentrations required for cancer prevention appear to be significantly higher than the levels currently recommended for bone health. This means a routine checkup might show your levels are sufficient for your bones, but still too low to provide your colon with the shielding it needs. Based on this research, the daily target for protection is at least 300 to 450 international units of vitamin D. You should aim to reach this number through whole foods, specifically milk, fortified dairy alternatives, fish, or eggs. At your next physical, ask for a vitamin D blood test and discuss these higher cancer prevention thresholds with your doctor. Following this simple dietary protocol has the potential to reduce the risk of early-onset colon cancer by half. While modern environments have increased our baseline risk, prioritizing vitamin D through the foods you eat is a direct, evidence-based way to protect your long-term health.